Kia ora koutou katoa, tēnei te mihi nui, kia koutou katoa, e mā takitaki mai ana. Nau mai, haere mai ki te manatū hauora. Welcome back once again to the Ministry of Health for today's update. Thank you very much for coming. Today I'm going to just provide an update on the Omicron response as ever, and also our continued use of some of the tools available in the COVID protection framework. I'm then going to hand over to the Ministry's Deputy Director General Māori Health, John Whānga, who will provide an update on the Māori response component of the Omicron outbreak. First of all, on the latest numbers today, there are 18,423 new community cases of COVID-19, with 913 people in hospital, 28 of whom are in ICU or high dependency unit. That's quite a drop from yesterday, and the vast majority of that drop is in the Auckland region. Quite a big drop in cases there, which fits with the drop in hospitalisations there, which fits with the drop in cases we are seeing there as well. Sadly, today we're also reporting an additional 11 COVID-related deaths, and that takes our total number of deaths we have reported to 221, and the 7-day rolling average of COVID deaths is now 10. I do want to pass on my condolences to families, whānau and friends of those who have passed and that we're reporting today. Now, you will have heard the Prime Minister yesterday, of course, update everybody on the changes to the COVID protection framework. The latest analysis we provided, as I outlined on Tuesday, confirms that significant drop in case numbers across Tamaki Makaurau and in all 3 DHB areas, and that's been accompanied now a few days later, perhaps about a week later, with a drop in hospitalisation numbers. And the drop in the total case numbers across the motu is reflecting that significant drop in Auckland. So in the 7 days to the 20th of March, there were 24 new cases per 1,000 people in the country, compared with 27 per 1,000 the week before. So saying that pattern varies across the motu. So Tairāwhiti, it is 44 per 1,000, and Hawke's Bay 38 per 1,000. They are the 2 DHBs with the highest rates at the moment. It's also clear that case numbers are on the increase, in particular in the South Island. From an ethnicity perspective, Māori currently have the highest rate at 35 per 1,000, then Pacific, and their rate is 28 per 1,000. The Pacific rate was the highest, but has now dropped. And the rates for New Zealand, European and Asian ethnic groups are currently at 21 per 1,000. A little more detail on some of the rates for the Māori population. There has been a decrease in the number of cases amongst Māori reported nationally for that week to the 20th of March. There were just over 27,000 cases, as opposed to around 30,500 cases the week prior. However, despite that drop in case numbers, there's been an increase during that week in the number of Māori who were hospitalised. It was 232 in that week to the 20th of March, compared with 202 the week prior. Again, we always tend to see this lag in hospitalisations behind case numbers. In terms of actual case rates for Māori, they are the highest in Tairāwhiti, at around 112 cases per 1,000, and next highest in the Hutt Valley DHB, followed by Hawke's Bay and Bay of Plenty. So saying, also in most other DHBs in the country at the moment, case numbers are showing an increase for Māori, and in particular in DHBs with large rural areas, where we're seeing case numbers out in those rural areas increase, and in particular higher case numbers amongst Tamariki and Rangatahi. So it's a very good time, because that will represent a lot of work for whānau, for iwi and communities there, and our Māori providers. So I want to say a huge thank you to our Māori and Pacific Health, Māori health and disability providers across the motu. They're working hard. They will also have staff down affected by the disease or by whānau members with the disease. So thank you for that huge work you are putting in. We are going to continue to identify individuals, whānau and population groups who are more vulnerable to severe illness through our community hubs and through primary care and our Māori and Pacific providers, and ensure that, that our resources are focused on assisting them to manage at home, or that they get hospital care if required. but at the moment around 97% of our cases are managing at home without any particular support, either from the healthcare system or from disability support, or indeed from our social development colleagues. So I'm going to now hand over to John Whaunga. Kia ora mai tātou, and over to you, John.
Tēnā koe Ashley, o te atura, tēnā koutou katoa. E rere ana nā tai o mihi kia koutou e mātakitaki mai ana i tai wiwi, i tai wāwā, tēnā koutou katoa. Tēnā koutou i rungi o tātou tini aitua, e hinga mai nei, e hinga atura. Ko koe tērā e wira, haere atura o te atura koutou. Koutou katahi anō ka mate i te mate korowhi, kōwhiori nei. Haere atu koutou ki te tini ki te mano, mai mai rā, ko koutou ki a koutou, ko tātou ki a tātou, huri rauna tēnā no tātou katoa. Today I'll be providing an update on the Māori response to COVID, highlighting the work we've been doing across the sector to support whānau Māori and to keep our community safe. Last December we released the Covid-19 Māori Protection Plan to guide the health and disability systems actions throughout the Māori COVID-19 response. The plan focused on two key outcomes which have remained central to our work. Firstly, protecting Māori communities by increasing vaccination coverage. And secondly, building the resilience of Māori health providers and whānau so they're able to respond to the new environment created by COVID-19 and its long tail. Implementation of the plan is underway, with progress being made in several areas. This includes gaining new insights into vaccine hesitancy, looking at how we can ensure our providers are supported to sustain their work, and supporting the delivery of clear, tailored communications for our whānau. For the Māori vaccination rollout, we continue to work closely with Māori health providers, district health boards and iwi to increase vaccination coverage amongst Māori, especially our tamariki. Our communications and engagement focus covers a range of efforts to promote vaccination. Booster advertising activity continues with the It's Time to Boost Your Whānau Protection campaign. This campaign has now entirely replaced the earlier Big Boost campaign with a more holistic messaging that focuses on the key motivator of protection and the need to ensure all our whānau members are vaccinated. The Karawhiua campaign also continues, and I want to acknowledge Te Puni Kōkiri and Te Hiringa Hauora for continuing to share positive content with whānau Māori in a way that resonates with them and encourages them to make informed decisions about their health and wellbeing. In addition to our booster and paediatric campaigns, Māori health providers have been partnering with DHBs across the motu to implement sprint strategies that support the Māori vaccination rollout. These kaupapa continue to demonstrate the need to take innovative approaches to reach equitable health outcomes. For example, in Te Tairāwhiti, the sprint event titled Super Shot Kids was staged at 3 separate locations, including Mangatu Marae. In the Lakes area, they hosted sprint events at Ōwhata Marae, Waititi Marae, with a further pop-up event at Ōwhata Marae for a second time last weekend, and a drive-through at Whakarewarewa Village Car Park. And in the Bay of Plenty, there have been a range of events that have been held recently across Whakatane, Opotiki and Kawerau. Several clinics were held in rural communities to help reach more remote whānau and increase their vaccination uptake. Testing also remains critical to the Māori COVID response. So to ensure the equitable distribution of rapid antigen tests to whānau Māori, a network of 29 Māori-led providers has been established. And so far, nearly 6 million rats have been delivered to this network, and approximately 1,000 community partners have received their rats, with over 300 plus iwi and Māori organisations also engaged in the portal to provide supplies. I want to mihi to all our kaimahi hauora, Māori health providers and Māori partners across Aotearoa, who have been working tirelessly to ensure our whānau are getting tested and vaccinated. Ka nui te mihi ki a koutou katoa. To make sure our providers can continue supporting whānau throughout the Omicron response, nearly $27 million has been allocated under the recently announced Māori and Pacific Omicron response package. Importantly, a portion of this fund is focused on supporting workforce capacity and wellbeing, which is a significant issue we've heard about from the sector. In the interest of getting funding to relevant providers quickly, a streamlined closed commissioning process is underway, and the Ministry has invited over 140 Māori health and disability providers to apply, and funds will be distributed in April. As mentioned by Dr. Joe Bourne on Tuesday, the COVID Care in the Community framework has been updated and is now available online. Equity remains at the heart of the Care in the Community program, and equity expectations of hubs are laid out in the COVID Care in Community Omicron framework. So far, 54 hubs have been set up, and the majority of these are Māori integrated. Many are also Māori led. An example of this is Waikato, which is one central hub and 11 Māori-led hubs. All of our hubs across the motu are providing a range of services for whānau, including the delivery of kai packs, medication, financial support, which is being managed by MSD, alternative accommodation coordination, health services, and manaaki services, where some hubs are supporting whānau to report their RATS results. Nā reira, a lot of work is already currently underway as part of our Māori response to Omicron. Much of this work is being led out by our Māori health providers and iwi partners. So before I hand back to Ashley, I want to thank each one of you. Thank you for your resilience throughout our response. Thank you for your innovation in the way you deliver services to our Māori communities. And thank you for your commitment to the continued protection of Aotearoa. You have been central to our response since the first outbreak, and we wouldn't have been able to achieve these gains we've made so far without your outstanding mahi. As Ashley said, please know the work you do is recognised, valued, and crucial. Nā reira, kei a koutou, nā kai hāpai o te hauora Māori, e aku rangatira huri noa tēnā koutou, tēnā rawa atu koutou katoa, me hoki anō ki te kōrero ōnehe, mā tini, mā mano, karapa te whai. Tēnā nō tātou katoa, ko hoa atu ki a koe anoa e Ashley.
Kia ora, John. Thank you very much, and I want to acknowledge the leadership you and your team have provided over these last 2 years. It wouldn't be a standout without me giving boosters a plug. So please, if you haven't had your booster, do go and do that today. For those who have had COVID recently, and if you haven't had a booster, we're advising a 3-month gap. However, book your booster for 3 months from today. Now is the time to do that. Book it in and make sure you get it. It is still important to do it and very worthwhile doing. And finally, 2 years ago yesterday, we announced our first cases of community transmission of COVID-19, which triggered our lockdown and started our whole of government response to COVID-19 in earnest. The Ministry of Health's media statement that day said, "We are preparing to move to alert level 4. There is a clear consensus that the sooner we do this, the better. This gives New Zealand our best chance of breaking the chain of community transmission. This will require all our efforts, and I strongly urge all New Zealanders to play their part." Well, 2 years later on, I would like to thank New Zealanders for playing their part over those 2 years through adhering to lockdowns, through staying at home when sick, getting tested when needed, being vaccinated, including getting boosted, scanning with the NZ COVID Tracer app, at least until this Friday, wearing masks, keeping gathering sizes low, and maintaining physical distancing. Many of these actions remain just as important now as they were then as we navigate this next period of the pandemic. If we keep doing the basics well, we will help to protect not only ourselves, but our most vulnerable people, our young children, older people, Māori and Pacific communities, disabled people, pregnant people, and people who are immunocompromised, perhaps because they are having treatment for cancer. We all know and care about someone in these groups, and our actions to date have helped protect these very people. Let's keep caring about them. I do also want to acknowledge